Hi, welcome to CVTV, and we're going to talk about the thing that you want to know the most about in terms of your blood vessels, and that's atherosclerosis or plaque. Dr. Osborne, welcome. Great to see you.
Thank you very much, Scott.
So I want to understand in the next 10 minutes everything there is to know about plaque. Can you do that?
Absolutely, we can do that.
Okay, rapid fire questions. First one is, what is plaque?
Plaque is that fatty buildup, that corrosion, that rust in the blood vessels that ultimately translates to strokes and heart attacks.
So the majority of strokes and heart attacks are related to plaque?
Absolutely.
No plaque, decrease dramatically those strokes and heart attacks?
No question.
All right. Second question is, where does it come from?
Comes from a lot of things. Choosing the wrong ancestors. So family history is important to understand. If everybody in your family has heart disease, that's an issue.
So if everyone in your family has heart attacks and strokes, or if anyone in your family has heart attacks or strokes?
If anyone, mom or dad, and in fact, if you look at your siblings, if one of your siblings has had heart disease or plaque, right? Plaque up here, we call that stroke. Plaque here in the heart, we call a heart attack. If you've got a brother or sister who's had plaque, who's had balloons, stents, bypass surgery, etc., your risk is even that much higher than if mom or dad had it.
Wow. So it's brother, sisters, even more important than mom, dad.
Yeah. But again, mom and dad are very, very important as well, obviously.
So no family history, no chance I have heart attack, stroke from plaque?
No, not really either. But certainly ancestry and genetics do play a significant role. The problem with ancestry and genetics, we can't change that.
Right. So what else does plaque come from?
Cholesterol.
Okay. What else?
High blood pressure.
Okay.
Smoking.
Okay.
And diabetes.
All right. So let's not talk about those because we're going to go into those in details on later CVTV shows. Let's just talk about what happens to plaque over time. And what is if plaque were a child, how does the child grow up? So what are the first things that happen? First of all, how does it start? What makes that place in the blood vessel where the plaque starts to grow?
So plaques begin to form in the vast majority of us in our first or second decade of life. So by the time we're teenagers, many of us have the initial little beginnings of plaque.
So it's not if we develop plaque, it's when we develop plaque, because all of us are pretty much going to get it at some point in our life?
Pretty much more likely than not.
So 15-year-old, 12-year-old, 13-year-old people may already have plaque. And you're going to look at family history and how big they are, if they have diabetes, high blood pressure, high cholesterol, to see the likelihood of them having it.
Yes.
Okay, so this little piece of fat starts in my blood vessel somewhere when I'm a teenager. What happens next?
Where that fat goes and how well it develops, or if it continues to develop, is dependent upon how well we fertilize it.
Aha.
So fertilizers for plaque, high blood pressure, diabetes, cholesterol, and smoking are the biggest factors, and the factors that fortunately we can change and modify.
So as this plaque, I'm picturing in my mind, if you will, a tube, a donut tube, and in the wall of the donut tube, I got a little bit of fat and it's starting to grow. Does this hurt me? Am I going to go, oh, there's my
Absolutely
plaque
not.
again? No?
No symptoms whatsoever.
No, I don't even know
You'd be completely unaware of it.
Okay, well that's scary. And so it's starting to grow. When do I care about this? When does this become a problem for me in my donut, if you will?
As far as my opinion, the moment it starts to form.
Okay, when is it going to possibly hurt me or give me one of these heart
20,
attacks?
30 years down the road.
Wow,
perhaps.
So there's a whole window of time that if we do something about it, we could maybe stop it from growing as much?
No question. And if we do a very good job, even help to reverse that plaque.
So I went to medical school back in the 80s, and we were taught this corroding pipe story of atherosclerosis, where the wall of the donut starts to grow, it grows bigger. As it grows, the inside of the blood vessel or the inside of the donut hole gets smaller, and then one day a blood vessel, a blood clot forms there, and everything downstream dies. And if it's at the top of your heart, then it's going to cause a bigger part of the damage, and if it's down. Is that the way it works?
To some degree, but we've really understood that there are subtle differences behind that model and what really happens.
And so let's take this plaque building in the wall of the vessel or donut. Does it have to get so big before it causes the heart attack or stroke?
What happens is, unlike we would think, we have a channel, that's the channel the blood flows through, but what happens is that plaque begins to form out in the wall of the blood vessel. And rather than immediately beginning to constrict the blood vessel, in fact, the whole vessel literally expands and gets bigger in order to maintain that channel.
Aha.
So we can have a whole lot of plaque out here and have no symptoms, be completely unaware of it. We have no signals. We have no evidence on stress tests. We have no chest pain as that plaque is beginning to grow.
Wow. So the blood flow is still okay, but my pipe, if you will, is becoming sick.
Yes.
So at what point is this process usually discovered in America today?
Right. The vessel will expand. Now there's a certain point at which it can no longer expand. It then begins to grow in and constrict that blood vessel. When we have symptoms, when we have chest pain, when we flunk our stress test, that generally means we got a 70% blockage of that blood vessel.
Wow. And is it when it's 70% blocked that the blood vessel becomes obstructed or blocked with a blood clot, or can it even sometimes just have stroke and heart attacks before it becomes 70% blocked?
Most strokes and heart attacks actually occur well before 70%.
So wait a minute. You just told me that the way that we figure out if it's blocked is we have you get on a treadmill, or we have you go through a nuclear stress test or an echocardiographic stress test, and that only shows up positive at 70%, and most of the heart attacks and strokes occur before 70%?
That's correct.
Well, how can we discover that? How can we figure that out?
Well, because most strokes and heart attacks occur long before we ever get a severe blockage, and what happens is you get a mild blockage, a 20, a 30% narrow, nothing that would ever cause you symptoms, nothing would ever show up in stress tests. But what happens is that plaque is mush, and it's unstable. And those plaques tend to rupture. And when they rupture, within seconds to minutes, you go from a mild blockage with no symptoms to a blood clot that forms on that ruptured plaque. That blood clot now completely blocks off that blood vessel, and now within seconds to minutes, you go on to have a heart attack or a stroke.
So what you're describing to me almost sounds like a pimple or something like that inside the blood vessel that starts to grow. It's not really blocking the flow very much, but then at some point the top of the pimple comes off and it kind of ruptures into the blood vessel and a blood clot forms right there. Is that what you're saying?
Absolutely.
Fascinating. So, well, I don't want that to happen to me, right? But I can't just do a stress test every year because we won't discover it in time. How can I find this plaque in my body?
That's been a big challenge in cardiology, and that's why at State of the Heart we have novel tools that allow us to go 10 to 20 years upstream to identify that. We actually call it a vulnerable plaque.
So you're going to actually kind of see into my future by looking at the blood vessel and seeing if there is a plaque in the wall of my blood vessel.
With apologies to Charles Dickens, we play the Ghost of Christmas Future.
Wow, that's really exciting. So let's just wrap it up here and review what atherosclerosis is. Atherosclerosis is
Plaque.
That is in the wall of the blood vessel that grows because of
Family history, diabetes, smoking, high blood pressure, cholesterol problems.
And it gets to a point, not blocking the blood vessel that much, where it can break open. And if it breaks open in the neck or the head, it's called a
stroke.
And if it breaks open in your heart, it's called
heart
a
attack.
If it's in the kidneys, that leads to
kidney failure.
And it can actually occur in your stomach sometimes too, can it? Giving you a bad stomach ache?
You can get aneurysms.
Wow.
Those are all manifestations of plaque. And even blockages in the legs too.
So sometimes when people get the cramps in the back of their legs when they walk, it's because this plaque is built up inside the blood vessels going down to their legs? Mm-hmm. Fascinating. So the way that we identify that is with?
We use tools that allow us to actually look directly at the blood vessels, not indirectly like stress tests, but directly at the blood vessels. And the tool to do that is called CT angiography.
CT angiography, or CTA. Cool. And if it's discovered, can you tell me when I'm going to die so I can go get my will, or can we do something about this?
If we discover it early, we can treat that plaque, and we can actually watch that plaque over a period of time literally reverse if we treat appropriately.
Fantastic. So, Dr. Osborne, thank you for sharing that with us today.
Thank you so much, Scott.
And for those of you watching CVTV, I have to confess, I knew the answers to a lot of these questions because a couple of years ago, Dr. Osborne did a scan of my heart and found plaque. And he put me on some aggressive medicines to treat me, and last Friday I had my scan again and there was no more plaque. He actually got rid of the plaque in my heart through the things that he knew and can teach me here at State of the Heart Cardiology. So I hope when you hear this, you ask the question, how much plaque do I have? And you'll strongly consider finding a doctor like Dr. Osborne and like State of the Heart so you can make sure that you don't have something happen that could have been prevented. Thank you so much for joining us on CVTV today.